Our next speaker is Aileen Satushek, and Aileen was born in Mount Vernon, raised in Arlington. She graduated from UW with a BA in history. She also graduated from the University of California at Davis with a PhD in anthropology. She also worked 26 years in the Bellingham-Whatcom County area as a leasing specialist in a variety of programs that provided housing to persons of limited resources. She has been serving on the United for National Healthcare Board of Directors for the last 2.5 years, and Aileen is also a very strong activist working on healthcare for all and the elimination of medical bankruptcies. So please welcome Aileen.
Well, I'm here to talk to you about where goes the battle for health care reform. And as you know, in March, Congress passed the Patient Protection and Affordable Care Act. And this legislation can be viewed as a faltering first step on the road to achieving health care for all. Many of the 45 million uninsured will be covered. And subsidies will be offered to persons under 400% of the poverty level, so health insurance will be more affordable for many people. And also, insurance companies will no longer be able to cancel policies of persons who get sick unless they can prove fraud. The new federal health care legislation, however, does have many shortcomings. First of all, it won't cover everyone. The federal government says that 32 million uninsured will be covered, which means that at least 13 million will be left out. Some analysts believe 23 million will remain uncovered. Secondly, there will still be medical bankruptcies, definitely among those not covered, but also among those who have health insurance. Insurance companies can still deny care. And the stop loss for a family of 4 that makes $89,000 a year is $11,000 per year. Now, $89,000 might sound like a lot of money, but in a major metropolitan area, a family that has a mortgage, car payments, 4 children, it's not going to go very far. But the stop loss would be $11,000 a year. By the way, that family is estimated, the federal government's own figures estimate that with premiums and deductibles and co-pays, that family is going to be spending $17,000 a year for health care. So you can see that bankruptcy was still very, very possible. And thirdly, the system is going to continue to be very expensive. In the USA, healthcare right now consumes 1 out of every $6 of our national economy. But it's projected by the federal government, and even Barack Obama has cited this figure, that by 2025, we're going to be spending 1 out of every dollar in our economy for healthcare. Well, I just don't think that the American people will put up with that, and it's certainly not sustainable. And on the average, Americans pay twice as much per capita for health care than is paid in other industrialized countries. And a major reason is that for-profit health insurance causes Americans to spend 30 cents out of every dollar for administration, whereas countries like Canada spend 5 cents. Now, a national single-payer healthcare system, which would be effectively an improved and expanded Medicare, would cover everyone, eliminate medical bankruptcies, and save $350 billion per year because of lowered administrative costs and also lowered pharmaceutical costs due to bulk purchasing. The author, T.R. Reid, has written a book called The Healing of America, and he discusses 2 other types of healthcare systems that also cover everyone, eliminate medical bankruptcies, and cut health care costs. Okay, given the fact that the current federal health care legislation is inadequate, what can we do to achieve health care for all? And as you probably know, many health care activists at this point, they're weary, they're tired. We've fought long and hard, and we don't have anything even similar to national single-payer health care. We don't even have a public option. Some people feel that we'll never win single-payer because forces with big pockets, such as big pharma and big health insurance companies, oppose it. But I'm not so sure. In his book, Do Not Resuscitate, Dr. John Gaiman points out that the American for-profit health insurance industry and perhaps even the American healthcare system are on the road to collapse because they're economically unsustainable. And I agree with Dr. Gaiman that by 2025, Americans will not tolerate or be able to sustain a system that consumes 1/4 of our economy and still leaves out many. My thoughts are that now is the time to pause, regroup, recraft our message, and get it out to the American people. We need to educate ourselves about the new federal health care legislation, its strengths and its weaknesses. We also need to educate ourselves about other universal health care systems throughout the world. And at the sign-in table, we have educational material. We have articles, and we have materials with references to books and websites. And you can also sign up for the United for National Health Care newsletter, which gives you references to study materials. Now, once we educate ourselves, we have to figure out how we can talk to our neighbors, even though they differ from us in culture and in politics. This will take time, patience, and perseverance, but economic trends and history are on our side. Despite our differences, we all need health care, and we need to find a way to provide it for each and every one of us.